Hello everyone, I'm S.ABIRAMI. I have done my bachelor's degree in optometry from Sri Institute of Higher Education and Research, Chennai. And now I'm doing fellowship in Strabismic Management from Indian Academy of Optometry, Coimbatore. Strabismus is the deviation of the eye, which refers to the misalignment of the visual axis, and the fusion will not be present in the strabismic eye. Strabismus is caused due to heredity or the extraocular muscles that controls the eye movement, or due to damage in the nerve of the extraocular muscle, or maybe due to injury. Basically, strabismus is classified into four types based on direction: esotropia, nasally deviated eye; exotropia, temporally deviated eye; hypertropia, upward deviated eye; hypotropia, downward deviated eye. So, the reason for why I'm doing this video is a patient came to our clinic for the general eye checkup. During this checkup, we have doubted that there should be presence of slight misalignment in either of the patient eyes. Hence, we have decided to do the squint evaluation for him. In that squint evaluation, I'm going to share some basic tests for the squint evaluation. So, let's initiate this. So here I'm going to do the squint evaluation for him, and in this evaluation I'm going to show the identification of the squint based on direction of deviation, based on competency, and also Hirschberg test and then cover test for this patient. So talking about the based on competency is nothing but the magnitude of the deviation should be equal in all the direction. When the magnitude of the deviation is not equal in all the direction, it will be considered as incompetent squint, and the magnitude of the deviation is equal in all the direction, it will be considered as competent squint. So let's check whether he has competent squint or incompetent squint. Instruct the patient to follow the pen tip only through his eyes and not by moving his head. I have already instructed the patient. I am starting at primary position, left side, levo elevation, levo version, levo depression, center is elevation, version, depression, right side, dextro elevation, dextro version, dextro depression. Hirschberg test is nothing but the corneal reflex test. Hirschberg test is done in this way. Instruct the patient to see the torchlight and observe where the corneal reflex is present in the eye while shining the torchlight. We can easily see that corneal reflex is located exactly at the pupillary center in both the eyes. Cover test is performed in the squint evaluation. So the cover test can be performed in this following way, and the cover test is done for both distance and near, and followed by cover test. I am going to do cover and uncover test. So cover test first do for the distance, then do for the near. Cover test and uncover test. Based on direction of deviation, he has left type esophoria. All the tests I mentioned before has been done. The result of the competency examination for this patient is competent squint. Test. This test is done to check whether the corneal reflex is presented at the pupillary center in both the eyes or not while shining the torchlight at mid of the two eyes. So, while shining the torchlight at mid of the two eyes, when the corneal reflex is present exactly at the pupillary center in both the eyes, then it will be considered as orthophoric. In case if the corneal reflex is not presented exactly at the pupillary center, Rather than that, it is presented away from the pupillary center in any of the direction, it will be not considered as orthophoric eye. So, the result of the Hirschberg test done for this patient is normal, hence he has orthophoric eye. Since the corneal reflex is presented exactly at the pupillary center. Cover test, it is an objective method to determine the type and amount of deviation that is present. It is usually used to identify the manifest squint and it is done monocularly. The result of the cover test for this patient is normal. Cover test, squint can be detected from the uncovered eye. Cover uncover test, yes, of course, it is also used to determine the type and amount of deviation presented in the eye, but it is used to determine the latent squint or hidden squint presented in the eye. It is done binocularly. We can suddenly observe the eye movement when the fovea is presented while the covered eye becomes uncovered, because the latent squint becomes manifest squint in the eye that is under cover. The result of the cover-uncover test performed for this patient is esophoria in the left eye, because his left eye makes movement temporarily while comes to fixation. That is, when the covered eye becomes uncovered, suddenly the eyeball moves temporarily to take fixation while uncovered. The result of the evaluation is, as we doubted before, the patient has phoria in his left eye. Thank you.